doesn't just affect your skin, it affects your life, your confidence, your relationships, and how you show up in the world. Today, Dr. Maureen Allen and Suzanne from Catrice are sharing solutions that work and what help you can get to get your confidence back. What an interesting topic. Acne. We want to know about it at every age. I mean, whether you're a teenager or you have PMS acne or perimenopause and menopause acne or acne on your back, it seems to be the one thing that we all suffer with at one stage or another. Is it a genetic thing? Why does it skip some people, doctor?
Yeah, so it's definitely genetic. If your parents have, your mom and dad have had acne, there's a 25% chance you're going to have acne. So definitely a genetic component.
But the biggest factor is obviously hormones.
Yes, absolutely, because it's the hormones that drive the oil. So the hormones are the androgens, which means male hormones, and very often it's the testosterone that converts to the dihydrotestosterone that stimulates the oil glands. And then, and then some people have a gene that they make more oil, unfortunately. And then you have like too many skin cells, and the pores get blocked, and the oil can't come out, and the bacteria change the now from P. acnes to C. acnes, just loves that mix, and then it causes inflammation, and that's where you get the acne pimple. So it's all about hormones.
What can you do to help, like from a lifestyle point of view, and that also affects your hormones?
Sleep, diet, fix your gut, make sure you're not eating foods that are inflammatory. So everything's about inflammation. So look at the inflammatory foods that you're eating. Very often, patients are drinking dairy, and the dairy, there's a protein in the dairy that's very inflammatory. So it's the casein in the dairy, not the lactose. So you can't go buy lactose-free milk. It's the casein in the dairy. So eliminate these foods one by one. And we have an acronym called GO. So it's grains, oils, industrial seed oils, so fried foods, anything that comes in a packet that's not fresh, alcohol, dairy, and sugar. So start off with the dairy, give it a chance, give it a few weeks and see if your acne improves. If not, you're going to have to go to the next one. Could be the grains that are causing the acne.
So sleep more to balance your hormones, eat better to fix your gut. So start from within.
Yeah.
And then you obviously want to cover acne when you have acne, Suzanne. Should I be avoiding certain products? What ingredients do you look for to be in your concealer or foundation if you want to cover?
I think when you go back old school, people always say don't put a mask on, but to be honest, the first thing you want to do when you have acne, specifically if you're a young girl, is you're so embarrassed. It is a confidence breaker a bit. So just be very selective of what you choose to put on your skin. The same as what Dr. Maureen just said, from the inside, from your gut, same applies to your skin. So choose things that will help your skin. The 4 main problems that we're going to see on your skin is going to be 1, too much oil production, too much sebum. Number 2 is going to be impurities, clogged pores. Number 3 is going to be the barriers broken. And once your skin starts healing, it might have pigmentation or scarring. And the last thing is your skin is actually dehydrated if you are taking or if you are on treatments. So in Catrice, we have, as I would call it, the trilogy treatment, was 4 main ingredients, which is Evermatte, niacinamide, willow bark, as well as glycerine. And a combination that we use is from a pore minimizing serum, or oil mattifying primer. And then you can apply your concealers on your pimples. You can also apply your foundation to keep it mattified. And then the last thing is to put an oil mattifying fixing spray. Not only will it set the makeup, control your oil, but it also contains, once again, hyaluronic acid to keep hydrating your skin during the day to regulate the sebum production.
What kind of topical skincare treatments do you add onto your skin, doctor?
I mean, like medical grade, yeah. So I just want to add, just check that that the ingredients are non-comedogenic.
Yes, definitely.
That's very important. And if you don't hydrate your skin, you automatically produce more oil. So that's why it's so important to hydrate the skin, like you were saying. So,
oh, really?
yeah,
Interesting.
you have to. Yeah. So we've just released a new product called Acne Relief, together with a compounding pharmacy. And it's got all these multifunctional products that work together. So there's something like azelaic, so a new form of azelaic, that is anti-inflammatory, antibacterial. There's a sebareductal, which reduces the formation of oil, and it also stops that dihydrotestosterone from forming. There's growth factors to start. There are 5 growth factors to start the healing, and 0.05 salicylic acid. And it's low because it's got all the benefits of the other ingredients, together in that complex. And that complex, you put it on, you start off once a day. You do it, we call it 3-2-1. You call it skin cycling, where you slowly start. So we say once a week, do it every 3rd night, then the next week, every 2nd night, and try build it up to every night.
It's about alternating.
And then wait a bit, and then once again, put those ceramides, we've got the triple ceramide to put it on to seal it in, but just wait a little bit, because, when you have active ingredients, you don't want to push them in too quickly. To seal the skin, especially at night, so that you hydrate your skin, so that you don't increase the oil production.
Yeah.
And then
remove your makeup properly.
Remove your makeup properly
use your
at night.
actives at night.
To use that.
And
Yeah.
the big thing is, don't over-exfoliate, because then you disrupt your barrier, and then you start over. You've got a compromised barrier. So maybe once a week you exfoliate, not twice a week, like normal skin.
And make sure that you do a good cleanse. Open your pores. Get that impurities out.
I always say
Nice.
double cleanse.
Even an at-home facial steamer.
Absolutely. Or a nice, warm compress. You don't want to be too hot on the skin and aggravate it. You don't want to dehydrate it. Just nice lukewarm compress.
Yeah. Because that skin is compromised.
Yeah.
That barrier is compromised.
You also, what in-clinic treatments are available that
we've
makes a massive difference immediately?
We first prep the skin for 2 weeks to repair that barrier and decrease the enzymes that make pigment, and then we do our anti-inflammatory peels like azelaic, and then we can go on to salicylic acid, because those are antibacterial, anti-inflammatory. And then we do our carboxy, which is incredible. It's our miracle gas. You inject it next to the acne pimple, and it actually causes like a deep cleanse. Sometimes you can actually see that pimple pop without having to push.
Wow.
And that's another big thing before I get. Do not push your pimple.
Everybody wants to push them.
You know this story too well. It's impossible.
Especially that cystic acne. If you have cystic acne, you really have to get your, those pillars of health perfect. And if it doesn't improve, you have to go to a dermatologist to sort it out, because you have no idea how much damage, and to fix the damage later on is very difficult.
Yeah.
So even when you have
scarring
acne,
that it causes when you, so that's why
the pitting and the scarring.
Little smiley face.
That's why I'm saying, don't leave the acne. Don't let your skin scar.
How do you recognize acne early on?
Well, you got the closed comma, the blackheads, and then slowly that gets infected, and you start getting the pustules and the pimples, and then you start getting that, sore ones that have got no head. And those are the ones, the deep cystic acne.
See, when my immune system's down, or when I've eaten many oily foods or dairy,
your skin
inevitably I will then break out. So you almost need to combat it by then saying, I need to exfoliate, I need to cleanse, maybe, as you're saying, some liver cleansing.
And also, like Dr. Maureen said, don't use things that's going to clog your pores. Don't use things that is highly petroleum based, or things like lanolin.
What kind of makeup should we avoid using?
Because you don't want to clog your pores.
So you just have to check all the ingredients in the products you are putting on your
Make
skin.
sure clean,
especially when you have
clean products. Lighter, I imagine lighter weight products.
Lighter weight foundations, lighter weight concealer. Coming back to color correcting concealer afterwards for redness again if it's still inflamed. Just make sure that you choose calming ingredients.
And the same treatment goes for acne anywhere on your body, whether it's on your back, or on your arms, or on your face. It's all the same acne, right?
Yeah.
Right. It's lifestyle. That's lifestyle, where you have to, because the back's a huge area.
Sure.
So really fix your gut, eat better, eat healthy, de-stress. Stress causes acne.
Yes,
another hormone. Yes.
Another hormone aggravating.
What's help you with the name?
DHEA?
No, the hormone that's released from stress.
Androgens?
The cortisol.
The cortisol.
Yeah.
Cortisol. So increased cortisol levels, increased acne. And
that's
so gut health, eating, lifestyle, topical exfoliating, clean skin, using good makeup products, and really preventing it is much much better than curing it. But if you do have acne, there's some incredible treatments
Yeah.
available now for
Yeah,
that.
and mothers, if you see your children have acne, and it's starting, don't let it, scar the skin. It's so
Yeah.
important not to
What can you
scar the
do
skin.
if you have young teenagers, about to be teenagers? I have a 12 and a 14-year-old, and I mean, I didn't have acne as a teenager, so it's very likely that they won't, because their father didn't either. But then I struggled with acne during PMS in my later years. But what do I do for them first and foremost now to make sure that I protect them from not getting acne?
So you get simple products. Number one, protect the skin, put the sunblock on. If they're playing sport, they must wash they wash their faces after they played sport, so they wash all that perspiration off.
So the pores aren't blocked?
Yeah, so start with simple things like salicylic acid. You get the other things like benzoyl peroxide, all those kind of things. But retinoids also help.
Cleansing.
Cleansing, retinoids, a mild retinol, to help.
Get enough sleep, eat
Yeah.
well, SPF. And my daughter, Suzanne, she loves to use makeup. So I'm very pedantic on the ingredients in it. Thank you, ladies. Very insightful.
Thank you.
Doctor Suzanne. Acne is definitely something that you can cure, but also something you can prevent. Gut health, lifestyle, enough sleep, avoiding stress, some amazing products available now from Skin Renewal and Catrice with the right ingredients in to help you cover your acne in the right way, to help you treat your acne in the right way. Some incredible in-clinic treatments, but mostly you should try and avoid acne and just live healthier, live better, and then you will have good skin.